Well, it's what you said. There's got to be balance. We need to protect the vulnerable from corona. That mammographies are down 87%, pap smears down 83%, colonoscopies down 90%, CAT scans down 39%. Millions of kids haven't gotten their pediatric vaccinations because emergency rooms have seen dramatic drops in people coming in with stroke and heart attack. They didn't stop having them.
The mental health aspect of this is really serious. I wish I could have a comment on that as well. Thank you, Mr. Chairman.
Mr. Chairman, point of personal privilege.
The gentleman is recognized.
Mr. Lukemeyer attempted to answer the questions of Mr. Lukemeyer, and I do not appreciate that his attempt to put words in the mouth of the Secretary in order to protect him and use me as an excuse for having asked questions that certainly should have been understood by me.
Mr. Chairman, I'd love to respond to that if you give me a second. I think it's important that we allow the Secretary to answer questions, which she refused to do. Allowed the Secretary to answer her questions, which she would allow him to do.
If he wants a colloquy on this, Mr. Chairman.
I'd love the colloquy.
All right, we will do that at the end of the hearing, or after the hearing, should I say. Thank you very much. The chair now recognizes Ms. Melania for 5 minutes.
I thank the witness for being here. I join my colleagues and White House staff. A speedy watched unfold this morning underscores the importance of testing asymptomatic individuals who may have been exposed to the coronavirus. We do not know who exposed the president to the virus or who he may have exposed, but who has come in contact with him get tested. And in fact, everyone should be tested in America. On August 24th, new guidance appeared on the CDC's website stating that most asymptomatic people should not be tested even if they have been exposed to the virus. So, Mr. Secretary, this guidance was directly contrary to the scientific consensus, and it has since come to light that this change was not made by CDC scientists, but by the president's political advisors who edited CDC's objections. One federal official told the New York Times, and I quote, "That was a doc that came from the top down, from the HHS and the task force, and it said, quote, does not reflect what many people at the CDC feel should be the policy," end quote. So, Secretary Azar, did you authorize the publication of this inaccurate guidance on the CDC website?
So I want to be clear, because you've made a misstatement there regarding the guidance of August 24th. The CDC has never recommended against asymptomatic testing. What the guidance posted on August 24th said was testing for individuals with symptomatic illness, individuals with significant exposure, including those who are asymptomatic, vulnerable populations, and healthcare and essential workers. What happened was there was a statement in the guidance that said asymptomatic close contacts do not necessarily need to be tested. Ensure that people
this must be Dr. Michael Stern
as a get-out-of-jail card, that they were done because, of course, you have an incubation period. They wanted to make sure that you consulted with a medical professional or public health person for potential incubation. That was so misinterpreted outside that the CDC then later revised that to clarify and say, yes, test asymptomatic close exposures.
Well, I think from the very beginning, scientists were saying that asymptomatic, you could get the virus from an asymptomatic person. You could get it from molecules in the air. That's why we're all supposed to wear people from us if we may be asymptomatic. So to say that on the guidance at the time, and according to the CDC officials that were quoted in various papers, they said that it was overruling them and their position. So responsible for making that change at that time.
So guidance that comes out of CDC is CDC's guidance. So Dr. Redfield is the director of the CDC. And as I said in my opening statement, we harness the best doctors, the best scientists throughout the government, throughout our agency, Dr. Fauci, Dr. Giroir, as well as Dr. Birx at the White House as the national coordinator. There's debate, there's discussion on any of these critical guidelines. See, it's Dr. Redfield supporting that and authorizing that, or if it's NIH trials and data, it's NIH.
Well, I'm glad that on September 18th you reversed yourself and recommended that asymptomatic people do get tested if they're exposed to the virus. We are currently seeing a spike in many cases in many states. Has HHS determined how many of these new infections may be the results of Americans following your inaccurate guidance before it was corrected?
That would have had nothing to do with the spread of disease. What we're seeing is community from the Midwest and the Northwest. We had an initial, some cases coming from universities getting back together, but that seems to have settled down now. And what we're facing now is just plain old community spread that comes from individuals not practicing the 3 W's. Wash your hands, watch your distance, wear your face coverings, especially indoor restaurants that are overcrowded or bars that are overcrowded, and especially, I want to emphasize this to the American people, home gatherings. You are not immune from catching the disease from extended family and multi-generational houses. You've got to be careful.
Reclaiming my time. And changing what was on the CDC website is another example, possibly of political interference with the Select Committee's recent analysis found that was directed by your department. The chairman mentioned 47 political interference with science. Another example is just weeks ago, a report appeared on the CDC website concluding that coronavirus is spread through airborne particles. Now, this is a big deal, and it could change the way Americans protect themselves. 2 days later, this information disappeared, and officials claimed that an early draft was posted in the secretary.
No.
Who directed that this information CDC's website and why? I can remember when I'm reading
Ms.
it
Melania,
and becoming very concerned about just walking down the street. And
time has expired. Melania, your time has expired.
Well, may he answer the question, Mr.
The
Chairman?
chair now recognizes Ms. Wolofsky for 5 minutes.
Okay.
Thank you, Mr. Chair. I'd like to agree with my colleague. Best thoughts, quick recovery to the President, to President Trump, and our First Lady for a quick recovery. Secretary Azar, thanks for being here. I wanted to start with the unprecedented efforts that are underway to develop, produce, and distribute a vaccine, because at the end of the day, that's our best kind of normal in this country. All of America is praying that one or more of these promising candidates prove effective. Dr. Fauci appeared before the subcommittee back in July, and I asked him about that topic because that is the topic that every American is talking about at the kitchen table. I want to ask you the same questions I asked him. So first, between existing government programs cover the cost of vaccines and the fact that many, if not all of the companies working on a vaccine have said they will provide it at a not-for-profit price or low cost, is it safe to say then that every American will be able to get a vaccine once it's approved?
Yes, everyone for whom it's indicated, yes.
Next, Operation Warp Speed is enabling clinical trials to get a vaccine to market more quickly. Has this or any other aspect eliminated any safety steps in the vaccine approval process?
No, we are in fact moving quickly because we can take the financial risk away from the drug companies, both on development and manufacturing, but the clinical trial standards are
safety standards in order to speed up the vaccine approval process, correct?
That is correct.
And the vaccine approval process is not subject to political interference.
Dr. Peter Marks, who is the Center Director for the Center for Biologics.
Thank you, Secretary Azar. Dr. Fauci gave similar assurances of a safe, affordable, and widely available vaccine. However, this vaccine will only be as effective as the American people's faith in it. Secretary Azar, the other day, former Vice President Joe Biden said that he is the Democratic Party. So when Democrats, including Joe Biden and Senator Harris, so doubt about the process, faith in the vaccine, and repeatedly say they do not trust President Trump's administration approval process, do these statements help or harm efforts to defeat coronavirus and overcome
those individuals in a political context, but I will approval process or makes unfounded allegations that somehow politics will warp science, data-driven processes. undermines public confidence in an eventual vaccine. Those vaccines, especially for those who are disproportionately impacted by COVID, American natives, African American community, Latinx individuals, we have to get those individuals in our clinical trials, and we have to ensure that they will have confidence in the vaccine if and when it is authorized.
Said that he only trusts Dr. Fauci on a vaccine. But as we've discussed, and as the record shows, Dr. Fauci has voiced his full support for Operation, that any vaccine that's approved will be safe and effective. If Joe Biden says he trusts Dr. Fauci, and Dr. Fauci says it's a safe vaccine, should Joe Biden and the Democrats be sowing doubt among American people about the vaccine and the need to get kids back in school and otherwise return to a normal way of life?
I hope nobody will undermine the public health by undermining confidence in the safety and efficacy of a vaccine that's approved by the FDA.
Thank you. Mr. Chairman, I yield back.
Thank you. The chair now recognizes Ms. Velasquez for 5 minutes.
Thank you, Mr. Chairman, and good morning, Dr. Azar, Mr. Secretary. You know, as a New Yorker and as someone who contracted COVID-19 at the beginning of the crisis in New York, if there is any value to wear masks.
Absolutely. We recommend it.
So how do you describe or assess, or what is your reaction to the fact that the first family that was sitting at the political debate, presidential debate, were not wearing masks?
So
does that make your job more difficult?
Our recommendations are always to wash your hands, watch your distance, wear a face covering when you can't engage in social distance, and avoid settings where you can't do those three things. Now, the first family and is a different situation than the rest of us because of the protocols around the first family.
Sir,
but our recommendations
reclaiming my time, it will send the wrong message to the American people that the first family, despite the fact, went to them and asked them to follow the rules, that they were sitting there, were not wearing the mask. That's the point. So said at a rally to slow the testing, and it is also quoted as saying that testing is overrated. Did President Trump tell you to slow the testing down?
I'm going to talk about the actions that we've done. We just this week announced 150
No, can you
million
please, I asked the question here, reclaiming my time. I'm asking you if the president tell you to slow the testing down.
I will not discuss my interactions or conversations with the president.
But it's of lacking a national strategy to combat the virus.
The national strategy is available for all to see at coronavirus.gov, including the national testing strategy, including the reports that you receive here at Congress about the national testing strategy on a periodic basis.
Thank you. Rather than implement a national testing strategy, the administration has pushed down the responsibility down to the states, letting them scramble to develop out their own strategy and find their own supplies. In Vanity Fair, White House officials refused to adopt a national testing plan this spring because they believe that outbreaks were primarily in Democratic states, and it will be an effective political strategy to time again from the other side, blaming Democratic governors. Sir, can you tell me what is the situation in nursing homes in Texas and some of the other states right now?
So we've been improving in terms of deaths. What we've done is published lists of red and yellow nursing homes that are experiencing excess cases, and we've had enhanced testing requirements that we've now imposed by force of law on nursing homes, and including with financial penalties and conditions of participation if they don't maintain control of cases and also fatalities.
So isn't it true that nearly half of all nursing home cases have occurred in states led by Republican governors?
I don't know. I don't think in terms of Republican or Democratic governors.
No,
I think in terms of humans.
The point is that this is not a blue or red issue. This is an American issue. And so I resent statements time and again about democratic states. It's the same situation that is happening in other states. Mr. Secretary, in the spring about whether to adopt an aggressive national state-led strategy.
We have an aggressive national testing strategy that also has states involved in it.
Okay. Secretary Azar, early this summer, CDC's guidance on school clearly stated that fully reopening created the highest risk. I will come back with just this question on the second round. Thank you. I yield back.
I thank the gentlelady for yielding back. The chair now recognizes Mr. Foster for 5 minutes. I'm sorry? Greensback. I'm sorry, Mr. Foster. Mr. Green had left, and so I see he's back. I now recognize Dr. Green for 5 minutes.
Thank you, Chairman, Ranking Member, and Secretary Azar. My Democrat colleagues take numbers out of context to blame President Trump for every death from COVID-19. They cite that there have been over 7 million positive cases in the U.S., and what they fail to mention is that the United States is one of the world's leaders in testing. We test more per capita than major countries like the UK, Australia, Germany, Canada, South Korea, Italy, and many others. And that's according to factcheck.org. According to Johns Hopkins, our daily percentage of positive tests is also very low at 4.68%. In comparison, India is at 7.2%. France is over 14%. Mexico is over 54%. Last month, the Wall Street Journal noted COVID-19 death rates in America had been on the decline. In April, the United States briefly peaked at 5.46 deaths per million. But for the past month, the United States has remained below 3 deaths per million. In spite of the vast increase in testing, Mexico, the UK, France, Spain, and Indonesia and others have higher case fatality rates than the U.S., but the left says just the opposite. The left manipulates numbers of a global pandemic and makes every death and every diagnosis the responsibility of the president. That is despicable. We continue to learn new information daily and constantly change previous assumptions about this new pathogen. I'm following the medical literature constantly, and it is changing over time. The left's mantra, though, is the same. Oh, there's no plan. Despite multiple plans like Operation Airbridge and Warp Speed, to say there's no plan, that's just deception. They may not like the plan, but if you say there's no plan, that's not true. The administration's swift response prevented the rest of this country from facing the fate like the early days in New York City. And they blame COVID-19. What they really fail to do is blame. They're the ones that lied about the virus, botched the response, hoarded PPE, and silenced whistleblowers. If China had acted 2 weeks earlier, according to a study by Columbia University, we've cited it before, 84% of deaths in the United States could have been prevented. Now the total number of American deaths is over 207,000. If China had been transparent, and we had been warned earlier, 173,000 Americans would be alive. Yet Democrats like our former Vice President Biden, called President Trump's China travel ban xenophobic. I mean, that's crazy. Even Democrat governors refused to accept the facts. I mean, I understand the previous comments, but Governor Cuomo refused to close down New York even after President Trump said we needed to. Recently, he even had the gall to cast doubt on the efficacy of the vaccine. He said, and I quote, "The first question is the vaccine safe? Frankly, I'm not going to trust the federal government's opinion." He then added, quote, "New York State will have its own review when the federal government has finished with their review." It's that capacity. Rather than trusting the nonpartisan experts at the NIH, CDC, and FDA, he's putting politics before science. Not recommend New Yorkers get vaccinated until his team conducts a second review. That's going to lead to people dying. It's despicable. The fact is, he's lost all credibility. A Columbia University study also found that if New York had shut down 2 weeks earlier, 20,000 people would be alive. Dr. Thomas Frieden said, he was the former commissioner of New York City's health department, head of the CDC, told the New York Times that New York City's death toll could have been reduced by 50 to 80% had social distance measures been in place a week or two earlier. Trump even had to threaten a quarantine of New York. Remember that? Everybody seems to have forgotten that. And because Cuomo so badly botched the response. Additionally, to send COVID-positive patients back to the nursing home against CMS guidance likely contributed to thousands of elderly deaths in New York State. My fellow GOP colleagues and I have requested that this subcommittee investigate that. Unfortunately, no answer. They don't want to hold their fellow Democrats accountable. They don't even want to hold the Chinese Communist Party accountable. They're more interested in smearing President Trump in a desperate attempt to win back the White House. That's despicable. Since their radical leftist base has embraced socialism and communism, we can no longer expect Democrats to push back on China. They will continue to prioritize politics over people, over good oversight, and the lives of the American people.
I thank the gentleman for yielding back. The chair now recognizes Mr. Foster for 5 minutes.
Well, thank you, Mr. Chairman and Mr. Secretary. I believe that public confidence will be crucial in the development and therapeutics, and that this will require robust and bipartisan oversight by Congress. So in July, Chairman Clyburn, Congressman Dr. Green, and I sent a bipartisan letter to the Comptroller General asking for the Government Accountability Office, the GAO, to conduct real-time oversight into Operation Warp Speed. The purpose of this GAO oversight is not to second-guess the work of our nation's respected scientists, but rather to ensure that crucial vaccine and therapeutic research proceeds as efficiently and effectively as possible, and that Congress and the public has confidence in the process. Part of the response to this has been excellent. For example, immediately after this, Representative Dr. Green, who's a conservative Republican who obviously I agree with on approximately nothing, he and I are actually getting a classified briefing on the classified aspects of Operation Warp Speed. So unfortunately, I also understand that HHS has been slow to provide full access to GAO to conduct this review, including evening processes, procurement, contracting, and so on. You know, in my time as a scientist, I've had experience having a project, billion-dollar projects under real-time oversight by the GAO, and it seems like a nuisance at the moment, but really can improve the quality of the project. The GAO is very sensitive to its role as a nonpartisan and a professional interface to Congress. Under the bipartisan direction of Representative Green and myself, really represents your best shot at having a high-quality scientific oversight by Congress into this. So, Secretary Azar, full and prompt access by the GAO to this important oversight material.
So we've received your letter. We're working on a response. We are responsive and cooperative with our auditors from GAO. We actually have 32 open GAO COVID audits just on that subject alone, and we're working with GAO to assist them in fulfilling their responsibilities without negatively affecting the department's life-saving mission during this historic pandemic. And we remain committed to working with and accommodating GAO in its COVID-19 related work.
All right. It would be nice to see some improvement in identifying the danger of vaccine hesitancy due to political interference. Do you believe this problem was improved or made worse by the political interference in the approval of hydroxychloroquine that was identified in Rick Bright's whistleblower complaint and his testimony to Congress?
Well, I'm not going to discuss that. What I will tell you is the emergency use authorization for hydroxychloroquine, there's so much misunderstanding about that. What happened was, we received a donation of, I think it was 3 million tablets from Bayer of product not in an FDA-approved GMP facility. It's Bayer.
Okay. Well, there have been long congressional hearings on the details of this, so please, if I could reclaim my client. Do you believe that the public misstatements by President Trump and the FDA director on convalescent plasma made the problem of vaccine hesitancy better or worse?
I know that the commissioner was very sorry for that statistical misstatement that he made.
Correct, and he as a scientist acknowledged his mistake and apologized for it. Have you apologized? His boss and your boss apologized.
Could you tell me which mistake I made? Because my remarks were
No,
actually
but
reviewed before I
he
walked
works for
on
you.
stage by Dr. Peter Marks, the career, very clear about the 35% relative risk reduction in mortality. I used to be at a drug company. I know how to talk about
No,
drug
I
trial
understand.
results.
I understand that, but I think it's appropriate when a significant misstatement is made by someone who works from you.
What did I mistake?
When someone who works for you makes a significant public misstatement, I think you have a duty.
I'll be honest. On the stage there, I did not notice Commissioner Hahn's misstatement.
Okay.
It was, I can assure you, an honest misstatement by the Commissioner.
But I think we can agree that that did
setting.
not improve the problem of going forward when you see that sort of. Now, on August 22nd, President Trump insinuated that the government scientists who work for you are trying to delay the approval of it. The deep state, or whatever, over at the FDA is making it very difficult for drug companies to get people in order to test these vaccines and therapeutics. Obviously, they are hoping to delay the answer until November 3rd. So my question to you, do the scientists that work for you over at HHS represent a deep state dedicated to politically sabotaging the president?
Our people at HHS are dedicated to the American people. I don't use terms like deep state.
Do you understand how demoralizing it is when the president makes statements like this about the scientists and then you do not stand up and confront the president for his demeaning of their motives?
It's important that we have confidence in the work of FDA. I support our scientists, I support our career officials, and I support our agencies.
Well, thank you. My time's up. Yield back.
The chair recognizes Mr. Jordan for 5 minutes.
Thank you, Mr. Chairman. Secretary Azar, let me thank you for testifying today, being with us this morning, and for your good work at HHS. We appreciate that. Open up their economy.
Yes, states can and should reopen their economy. There are ways to do that very safely.
You know, we've heard some talk earlier from some of my colleagues about New York State. I've been just kind of interested in a little comparison here. Which state has a greater population, Florida or New York? Do you know?
In terms of population, I believe New York is 20 million, about 20 million, and I believe Florida is about 22 million, so I think they're roughly the same.
Roughly the same, but maybe, well, roughly the same, but of course Florida has 2 million more people. Do you know which state has more seniors in their respective state?
I would have to believe Florida does. I don't know, I don't have the exact data, but I would assume Florida does.
Yeah, and you'd be right in that assumption. You know which state has more seniors in nursing homes, Florida or New York?
I would, for the same reason, believe it would be Florida.
Sure is. Now, and which state had more hospitalizations for COVID-19? Do you know?
So in terms of, and I wanted to correct something. I actually did have a note here on Florida has 70,000 nursing home residents. New York has 100,000 nursing home residents, so I did want to be precise on that. I don't have the numbers on hospitalizations. Florida had 24,656 hospitalizations. New York, city plus the state, 73,238.
3 times as many, approximately. Is that right?
Yes.
Which state, and look, this is terrible no matter where it happens, and we wish we had 0 deaths from COVID-19, but which state had more of their residents, their citizens pass away from COVID-19, New York or Florida? Do you know?
New York had over twice the number of deaths, 32,864 COVID deaths versus Florida with 14,320.
And might that be because the leadership in New York didn't follow the guidelines that came from the Trump administration? Specifically, as my colleague from Tennessee pointed out, didn't follow the guidelines for 46 straight days when they put COVID-positive patients back into nursing homes. Might that have something to do with that terrible number?
It very well might, as we see from the data on nursing home deaths. New York had 4,650 nursing home deaths, and Florida had 3,200 nursing home deaths. I got to see firsthand the difference in treatment, what Governor DeSantis did, creating COVID-only nursing homes and COVID-only wings, and then see what New York did, where they scattered COVID-positive patients out of hospitals and basically sprinkled them across nursing homes, contrary to guidance, and then tried to blame us for having said that should happen when our guidance was directly contrary, saying you should do COVID-only wings and protect the vulnerable.
So Florida followed the guidelines, and guess which state is opened up today, has their economy much more open. Guess which state is more open, Secretary Azar?
I believe Florida has more open in terms of its removing restrictions.
Yeah, and it shouldn't surprise anyone that when you're able to follow the guidelines, do things in the safe and proper way, you can open up your state. And guess which state has the lowest unemployment? Florida, New York. Which do you think it is?
Florida, I believe, has lower unemployment.
Yeah, like half. They got twice the unemployment level in New York that Florida has. And this is maybe the final thing. If we'd have had states follow the guidelines, if we'd have states open up safely, imagine what our economy could be doing now. I mean, I think the Great American Comeback is underway, but it's underway, and you're seeing these good numbers that we're seeing as the economy starts to reopen, in spite of the fact that New York, New Jersey, Pennsylvania, Michigan, Illinois, and California are still largely locked down. So those are 6 of the I think the 12 largest states population-wise in our country still largely locked down, and yet in spite of that, you've got the economy moving in the right direction. Imagine if they'd have followed the guidelines and be in a position where they could open up like the state of Florida did, how much better off the country would be, how much better off families would be.
We can open this country's economy up, and we get the issues that we spoke of earlier, health versus health. By being open up and doing it in a safe way, practicing good behaviors, it can solve all the other health issues that counterbalance against the impacts of COVID.
Well said. Again, thank you for being here today. Thank you for your service to the country. Mr. Chairman, I yield back.
Thank you. Mr. Chairman, would you mind if could I correct, I accidentally gave a wrong number earlier in reference to France, and I said 126,000 per day. I was in my head, I had accidentally, I believe their per capita rate is 3 times the U.S.'s per capita daily rate, and I accidentally multiplied that out to the U.S. population. So if I could, I just would like to correct that. I didn't mean to misstate that, but my point was that France's daily cases on a per capita basis are higher than the United States' cases, but the 126,000 number was incorrect. I apologize for that, Mr. Chairman.
Very good. Thank you very much. The chair now recognizes Mr. Raskin for 5 minutes.
Thank you, Mr. Chairman. And I want to add my thoughts for swift and complete recovery to the President, the First Lady, and the other 3,752 people who contracted COVID-19 yesterday. And my thoughts are with the families of the 857 Americans who died yesterday. Mr. Secretary, we now are over the 206,000 mark for Americans who've died from this terrible disease. That's more Americans.
All right, everybody, we are going to breaking news outside of the White House. Mark Meadows, the White House Chief of Staff, is coming up to the media. He is going to be addressing and giving a report to the reporters here after President Trump tests positive for COVID-19.
Good morning. Obviously, we had a great jobs report this morning. Unemployment down below 8%, and the economy continues to be robust in its V-shaped recovery. And unfortunately, that's not what everybody's focused on this morning. As all of you know, the President and the First Lady tested positive for COVID-19. They remain in good spirits. The President does have mild symptoms, and as we look to try to make sure that not only his health and safety and welfare is good, we continue to look at that for all of the American people. He but very energetic. We've talked a number of times this morning. I got the 5 or 6 things that he had tasked me to do, like I do every single morning, and he is certainly wanting to make sure that we stay engaged. I think the other thing that is critically important, the doctors continue to monitor both his health and the health of the First Lady. We'll continue to do that. They'll be glad to provide some updates later today as we look at this. But I think the great thing about this president is not only is he staying committed to working very hard on behalf of the American people. His first question to me this morning is how's the economy doing? How are the stimulus talks going on Capitol Hill? a number of us in the core team of the White House continue to get tested on a daily basis like we are, like we have been, and as we look to that, we're very excited about making sure that not only that the health and safety of the President and the First Lady is addressed, but certainly that we address this battle together as a nation together, and the American people can rest assured that we have a president that is not only on the job, will remain on the job, and I'm optimistic that he'll have a very quick and speedy recovery.
Mark, how would you describe his symptoms, and is he taking hydroxychloroquine?
Well, I'm not going to get into any particular treatment that he may or may not have. He has mild symptoms. As we look at that, the doctor will continue to provide expertise. He's in the residence now, and in true fashion, he's probably critiquing the way that I'm answering these questions. And I can tell you that a number of us will be reporting back to him on the task at hand.
What day and time, would you just clear this up, what day and time did you find out that Hope Hicks had tested positive, and did you sit on it until after the president went out to his fundraiser in New Jersey?
Actually, as we look at this, I'm not going to get into the TikTok. I can tell you in terms of Hope Hicks, we discovered that right as was taking off yesterday. We actually pulled some of the people that the reason why it was reported out, and just frankly, is that we had already started the contact tracing just prior to that event. As you know, last night, even in the early hours of this morning, the minute we got a confirmatory test on the president, we felt like it was important to get the news out there at that time, and so that's why we sent out the tweet late, or actually early this morning. You know,
why aren't you wearing a mask right now?
Yeah, so I've obviously been tested. We're hopefully more than 6 feet away, and if there's any concern there from a guidance standpoint, we have protocols in place, and we, you know, when early on when we first started to tackle the COVID-19 battle, we actually did two different things in the White House, a number of contingencies as we looked at not only additional testing, but certainly mitigate for social distancing in private meetings and the like. But I think it goes to the broader question is even with a lot of the mitigating factors, Jim, what you have is a virus that is contagious, that certainly continues to be, regardless of whatever protocol we have, that it has the ability to affect everybody. As you know, the president, we keep a pretty wide circle. All of you that have interacted with him know that. Around the president, we find that he's having to deal with this like of other Americans and people around the world have had to do. I can tell you that what we're doing is focusing on the therapeutics, the vaccines, continuing to do that, and that doesn't change. Yeah. Go ahead. Go ahead.
Ask really quickly, the officials who were on the flight with the president on Wednesday, including Kushner, Scavino, I think Stephen Miller was there, are they all quarantining? Have they been tested?
We've tested all of our core staff, and I can tell you that you know, Mr. Kushner, Mr. Scavino, myself, a number of us have been tested, have come back with negative results, and yet at the same time, I fully expect that as this virus continues to go on, other people in the White House will certainly have a positive test result. And we've got the mitigation plan in place to make sure that the government not only continues to move forward, but the work of the American people continues to move forward. And so even as recent as this morning at a little after 8 o'clock. The president was giving me a number of things to make sure that I get done, and I'm sure that I will actually have those due outs have to be back to him later today. I've got a wrap. I'm not going to ask. So I wanted to come out and give an update to all of you so that show the courtesy of giving an update. We'll have future updates. I'll be glad to do that. But any other specifics at this point would be not. Okay.
All right, that was Mark Meadows, their White House Chief of Staff, talking about President Trump and the positive test that we all know about right now, but saying that the president is in good health right now. He's staying positive. He's in good spirits. And the first thing that he asked Mark Meadows, the Chief of Staff, this morning, how's the economy doing? How are the job numbers there? So that does sound like how the president does interact there with his Chief of Staff on any day of the week there, and it just so happens to be on the day where he did test positive alongside his wife Melania Trump there as well. We have full coverage for you here on News Now from Fox. Thank you so much for joining us here today. I'm your host Mike Pace as we continue to navigate this breaking news story, really the biggest story of 2020. Let's continue to go out to the U.S. House hearing right now where we're getting an update there on the latest on COVID-19. We will continue to wait for more updates from the White House, from President Trump. If he tweets out anything, we will bring it to you right here on News Now from Fox. Everyone, back out to the House hearing.
Well, the litigation position that the Attorney General's advocated there in the Supreme Court is a statutory construction and constitutional position. The policy position, which I can speak to, is we want people to have a good system with affordable access to health insurance and affordable health care, and we're going to work with Congress. If the court creates a situation where we need to replace it, we're going to work to get that.
Were you consulted by the President or by anyone else in the Cabinet or the Justice Department before the Justice Department of this administration moved forward with this effort with the Supreme Court?
Well, again, I'm not going to discuss my consultations with the President or cabinet level. I can speak to is we want people to have a good system with affordable access to health insurance and affordable health care, and we're going to work with Congress. If the court creates a situation where we need to replace it, we're going to work to get that.
Were you Cabinet or the Justice Department before the Justice Department administration moved forward with this effort with the Supreme Court?
Well, again, I'm not going to discuss my consultations with the President or cabinet level consultations. I can't do that, as you know.
Mr. Chairman, I yield back.
I thank the gentleman for yielding back. I think that completes the first round of questions. Now, vote is on, but I think we'll monitor that so that we can, okay, very good. We'll now go to a second round, and I will yield myself 5 minutes. Mr. Secretary, the website of the Department of Health and Human Services states that its mission, and I'm quoting here, is to enhance the health and well-being of all Americans by providing the effective health and human services and sustained advances in the sciences underlying medicine, public health, and social services. End of quote. I wholeheartedly endorse this mission. HHS must use sound science and sound science alone to enhance Americans' health and well-being. Do you, Mr. Secretary, believe that you and the other political appointees in this administration have fulfilled this mission during this pandemic?
I do believe so, yes. I believe that I've stood up for science, data, evidence. We've made these doctors have become household names: Fauci, Redfield, Hahn, Birx, made direct access to the American people in ways that has never been done before to ensure they hear right out of these scientists' mouths the best information that they have. We've made sure those people have direct access to the President, and he's speaking with them, and he's hearing from a multitude of the best science voices. I ensure that. I don't like to meet with the President without one of those top scientists being there or all of them being there. I try to always encourage science, data-driven deliberations. That doesn't mean that our scientists and doctors can't have debate. There is debate in science. That's a core part of the peer review process. It's one of the hallmarks of scientific enterprise, and I encourage and sponsor that.
Very good. So you think you're doing it. Okay. Regrettably, the science-based mission of the department was betrayed by senior political appointees like Assistant Secretary for Public Affairs Michael Caputo, who reports to you directly, and his former advisor, Dr. Paul Alexander. I want you to take a look at this poster here. We received emails that clearly show that Mr. Caputo and Dr. Alexander bullied and overruled CDC scientists who tried to inform the public of the risks of the coronavirus. On June 30th, after the CDC's principal deputy director said people should wear masks, Dr. Alexander wrote, and I'm quoting here, her aim is to embarrass the president here. He called this career scientist disingenuous and duplicitous on August 8th. After the CDC reported that children could spread coronavirus, Dr. Alexander wrote, and I'm quoting him, this is designed to hurt this president for their reasons which I am not interested in. In that same email, Dr. Alexander told CDC's director, nothing is to go out unless I read and agree with the findings, how the CDC wrote it, and I tweak it to ensure that it's fair and balanced and complete. These emails show clear political interference in the CDC's efforts to carry out the department's science-based mission. Mr. Secretary, will you renounce this kind of political interference and commit that it will not happen again?
Mr. Chairman, as I said, I support debate, I support discussion, I support challenging each other. I do not support those statements. Dr. Alexander is no longer employed at this department, and I won't get into personnel matters, but there is a way to have discussion and debate that is proper, respectful, appropriate. And let me be clear, especially about that second quotation there. I do not know of any circumstance where anybody other than Dr. Redfield and Dr. Birx would have authority over determining the final publication of an MMWR, which is that issue. Dr. Alexander, to my knowledge, never had that authority. I would not have supported that. But I do not find that tone and tenor of discussion to be acceptable in my department.
Well, thank you, Mr. Secretary. You may recall that when these statements came out, I wrote you a letter asking that these people appear before our select subcommittee. Mr. Secretary, not a single staff has been made available to appear before this subcommittee, not a single one. I will hope that you will agree and begin producing the documents and allowing these witnesses to come forward next week. I'll be glad to come back up here, and I'm sure my ranking member will participate. Will you do that?
So our staffs are working to secure the agreements on the procedures to make that happen. We want to make that happen, just working on the final arrangements on that.
Thank you. I took that as a yes.
Well, they need to get to agreement on appropriate procedures to protect individuals. Some of these are some of our career CDC officials, for instance, and as you know, Mr. Caputo's on medical leave right now with a very serious medical condition. Dr. Alexander no longer works at the department or the U.S. government, but we're working with your staff to get to agreement on how this can be facilitated.
Well, I think that if my memory serves, that I'm here in person and you're here in person, but the ranking member has on occasion participated virtually. And we'll be pleased to have a virtual testimony from them if they will agree to appear. So we don't have to come back as necessary. I think we're doing that because of you and me, but we can do it virtually. Okay?
So we'll get our staffs there. I think they're in the final stages of getting things arranged.
Thank you very much. I'll yield to the ranking member 5 minutes.
Thank you, Mr. Chairman.
Took maybe 30 seconds more. 5 minutes and 30 seconds.
We're good, and I appreciate the second round. Secretary, thank you for continuing to answer these questions. I know when we talk about vaccine advancement as well as other therapies, you talked about remdesivir, hydroxychloroquine. I've talked to internalist doctors who are using it effectively. Of course, a doctor is the one who knows what's best for them and their patient. Hopefully, we continue to make as many options available that are safe to doctors so that they can continue to help treat patients. Are you seeing an increase and an improvement in the ability to effectively treat people who are COVID positive compared to where we were a few months ago when this disease came from China?
Congressman, the advances in our ability to care for people and help them recover who suffer from serious consequences from COVID have been nothing short of revolutionary. As I think I mentioned earlier, just to take one data point, in April, an individual age 70 or above who contracted COVID would have a 30% chance of dying. Today, that's about 5.7% chance. That's thanks to the President's efforts to get remdesivir approved and have supplies, steroids for lung injury, now convalescent plasma in over 80,000 patients. Just even as we've learned about how to, as you mentioned earlier, how to use ventilators better, when you use them, how to use forced oxygen better, how to use proning and quality of care. And my department's played a vital role in educating providers across the country as they've seen surges and declines in cases to enhance knowledge among providers.
Yeah, and that's something I've seen directly. In fact, we've, here in Congress, passed some of the money to give the department the ability to respond even more effectively, to come up with and produce vials of vaccine. As these companies are in the final stages of testing, we're not waiting for one to be approved to start manufacturing the vaccine. It's part of Operation Warp Speed. In the old days, they would say, well, if one clears through the final stage, then they'll start producing it, and then, of course, that would be months later. We're actually making those now.
That's right.
Now, obviously, if they're not approved, then those go in the trash can. But if they're approved, that saves us vital months. Is that part of President Trump's plan that we're doing that, or is that how it's always been done?
No, this is historic and unprecedented that we are, at the same time that we are advancing the development to demonstrate safety and efficacy, we are literally making, as we speak, we have millions of doses of vaccine, and we are making them at industrial scale across 6 manufacturers right now, something no drug company ever would have been able to do on their own without the support of the U.S. government. That was the innovation President Trump created in Operation Warp Speed.
And with any other virus, have you seen a vaccine potentially created within a year of a virus being known to mankind?
Never, never. I worked very hard on the Ebola vaccine. I played a critical role in the Democratic Republic of the Congo on eradicating Ebola in the 10th outbreak in the eastern DRC. And there, thanks to America, we had a Merck vaccine. We had various monoclonal antibodies, but those took years to get. We're talking months.
Yeah. And this is another story, again, that's not told because, unfortunately, some people want to just politicize everything. And, you know, if the vaccine's not a week later after the virus is known, then it's all the president's fault. And, you know, we see this yet. We're literally on the verge of 4 potential vaccines less than a year later, with millions of vials already being mass-produced, in part using the Defense Production Act, which the president has been very effective at using as well. Let me ask you about New York, because this is very, very concerning. Again, as you see some people trying to plant seeds of doubt in a vaccine, which would be deadly if they did it. Deadly. New York saying that they will not allow their citizens to have access to the vaccine until they have some other approval process. Have you seen New York's approval process? Do you know how long it would take? How many months would people in New York be denied a vaccine if the governor gets his way?
I have been unbelievably distressed by the remarks of the governor. It undermines public health. It undermines confidence in vaccines, not just for COVID, but for kids getting their MMR vaccines. And New York has been a hotbed of the anti-vax movement.
Right. Does New York have their own testing process that you know of, Secretary?
I'm sorry, does New York?
Do you know if New York even has a testing process that
No,
Governor Cuomo talks about?
Of course they don't. We have a single federal system
how many
for
months
drug
would the
approval.
citizens of New York be denied the ability to save their own lives if Governor Cuomo gets his way? God help us. Hopefully he doesn't get his way. but it's a ludicrous statement. And again, these are the kind of statements that undermine public confidence. I know you said that you agree with that as well. I do want to jump to China real quick, because this, unfortunately, is not an area where the committee has gone, and we need to go there further. But I was in some of those meetings in the White House months ago when we were trying to find out more, when we knew nothing about this virus. Chinese health officials wanted to let us in. Our top health officials wanted to go in. Wasn't it the Chinese Communist Party that stopped us from going in and that corrupted the World Health Organization from at least being honest about the human-to-human transmission?
The Chinese Communist Party delayed by a month and a half the CDC or WHO teams getting into China. I offered that on January 6th.
Do you know how many lives we could have saved if the Chinese Communist Party didn't deny us?
Countless lives there and here from what we would have learned. Because we ended up learning a great information from being able to be there about how to care for patients, but that was a month and a half delayed.
So lives would have been saved. Thank you, Mr. Secretary, and I yield back, Mr. Chairman.
Thank you, Mr. Ranking Member. The chair now recognizes Mr. Velasquez for 5 minutes.
Thank you, Mr. Chairman. Secretary Azar, early this summer, CDC's guidance on schools clearly stated that fully reopening created the highest risk. In July, the CDC released new guidance substantially edited by White House officials that downplayed the risks of reopening schools. Secretary Azar, were you involved in instructing the CDC to issue new guidance?
I'm not aware of an instruction for CDC to issue. They update their guidance, and there is a collaborative interagency process, as there would have been, I assume, under President Obama with the Ebola response or H1N1. It's quite normal that you have a White House coordinated guidance review process.
Okay. And you believe, and it is your opinion, that it's not appropriate for political advisors to write public health guidance?
I believe it's perfectly appropriate for all individuals who have competence and expertise to contribute, whether politically appointed or career officials. Dr. Redfield is politically appointed. He runs the CDC. He is the final sign-off on CDC guidance.
Political advisors such as Jerry Kushner.
I'm sorry, who?
Jerry Kushner.
I'm not aware of Mr. Kushner's involvement, but
okay.
I don't know that I'm aware of that. But it's perfectly normal for there to be, all guidance is required to go through a White House process. That's presidential executive order. Significant guidance has to go through White House review, and who sees it there, I don't know. But at the end, I want to be very clear about it. At the end of the day, the CDC director must agree with it, or it does not go out. Okay. Any edits, any changes, any suggestions. I'll back him up on that.
The CDC reports that over 40% of all COVID cases between the ages of 5 and 17 are Latinos. Isn't it true there is evidence that young children can transmit the virus?
Oh, yes. Children can transmit.
Okay.
Yes.
Thank you. And you agree that transmission of COVID is higher in poorly ventilated or enclosed areas?
Congresswoman, on that issue, I just want to be careful to, I want to defer to the experts at CDC in terms of if they, I believe that to be the case, but I would want to refer you to CDC guidance on that rather than speculating on that front.
So are you aware that a recent GAO report found that 36,000 schools nationwide need ventilation upgrades?
And that's what, I think there's in the Congress's statute that you passed, I think $13 billion of funding for schools. I do believe there are some issues on ventilation systems that can be good upgrades to freshen the air and keep it going, and also to keep adequate humidity levels, which can be important in terms of the dehydration of the product.
Do you think
President Trump
right?
and First Lady Melania have tested positive for coronavirus. The news comes just hours after the president made a visit to New Jersey for a brief fundraiser. So we want to bring in our political analyst, Bruce Gordon. I think there's two parts to this.
Infrastructure is old and it hasn't been upgraded. Do you think it's right to say that we should fully reopen the schools in those areas?
We do believe we can reopen fully. As a question, the question is, there are steps you can take, cohorting kids, creating social distance, moving teachers from classroom to classroom, delivering meals to the kids, social distance in the classroom, of course, face covering wearing, and also, but at all points, the individual making decisions what's right for the parent and the guardian deciding what's right for their kid, and what vulnerabilities they or other household members have. That's vital they be in the driver's seat.
And do you think that we have enough money nationwide to be able to upgrade all those schools?
I haven't looked at that issue of funding. I know
well, you should, because you are the secretary.
Well, there's $13 billion of Department of Education funding that I don't believe has been fully allocated or pulled down by the school district.
Okay, it hasn't been fully allocated, but my question to you is, given the GAO report and the thousands of schools nationwide that need ventilation upgrades, my question to you, you are the Secretary of Health. You are the one saying that presumption should be we get our kids back to school. So do you feel confident that having 36,000 schools nationwide in need of ventilation upgrades, that the money is there, that has been allocated, is appropriate?
Well, there's several assumptions in there in your multiple questions. The key point is the presumption is kids should be back in a physical environment. They're not being there. Dr. Redfield, Dr. McCants-Katz have made it clear is destructive to children's physical, emotional, mental health, and their development. It can be done safely, but we always have to look at the individual circumstances to make sure it's safe in any particular school or situation, and an adequate plan to make that happen.
The fact of the matter is that there are 36,000, according to the GAO report, in need of upgrades, and that therefore, to make such a statement at let's send the kids back to school, it doesn't provide the peace of mind to the parents of this country. Reports indicate the White House pushed for testing guidelines to be changed to recommend that people without COVID-19 symptoms abstain from testing. But 16% of kids with COVID-19 are asymptomatic. So what testing guidelines are you recommending for schools, especially knowing the significant impact COVID-19 is having on children of color?
So we recommend the testing of asymptomatic close contacts. So in a disease tracking situation, that's why we've worked to get Binax now testing out 100 million of those tests that we've asked the governors to prioritize for the K through 12 kids to do contact tracing, as well as to assist with surveillance, because in addition to close contacts, we want to ensure that we have adequate surveillance systems to identify if we're seeing emerging disease outbreaks.
Thank you. I yield back.
Mr. Lukemeyer, you're recognized for 5 minutes.
Thank you, Madam Chair. Secretary Azar, I live in a very rural area, and a big chunk of my district is very rural. And I know throughout this pandemic, a lot of the healthcare services have been delivered by the telehealth way of going about it. And to me, this is extremely important going into the future, that we allow this to continue to happen. I know there's been some rules and regulations that have probably been waived or changed to be able to accommodate. I'd like to give you a few minutes to talk about some of the rules, regulations, problems, the things that we can implement, suggestions for Congress on how we can make this a better service between the healthcare professionals and the constituents and customers of this country for the betterment of their health care. Would you like to comment just for a few minutes on that?
Well, absolutely. Thanks to the national emergency powers of the President, we've been able to, for the first time ever, really unleash the power of telehealth. We've brought health care into the 21st century for the first time. And when you go out and visit hospitals and doctors and community health centers, as I have done, you see that it has been a truly patient-centric change in healthcare, and it's bringing overall healthcare costs down and creating a better experience. I've been to community health centers which treat the underserved, and they're delivering 90+% of their care by telehealth now, and having drive-through lab testing and sample taking, vaccinations, et cetera. So they're combining them. Past assumptions were that telehealth would be additive and just add cost to the healthcare system, but we're seeing it actually improves quality and decreases cost. We need Congress to act, though, on this, because we can't enshrine in regulation everything we've been able to do. We can do much more in rural, America under statute. We can't do that in urban. In addition, in rural, you still have to, under the statute, show up at a doctor's office. You can't do it from home. You have to have a pre-existing relationship with a doctor or hospital before. We've waived all of these things thanks to President Trump under the emergency powers, but Congress will have to act to make those flexibilities permanent. So we really hope that Congress will act. I don't think you can walk this backwards, nor should you.
Well, I appreciate that, because I think what we really need to do is, as we wind down from this thing at some point, we need to get together and figure out the rules, regulations, what it's going to take to implement this on a national basis, on a permanent basis, to be able to be helpful to both the healthcare professionals and the improvement of health for our citizens. So I thank you for that. I know I saw this week, I think it was Wednesday, September 30th, in I think it's the Wall Street Journal here. There was an article with regards to Regeneron and their the medication that they're coming up with. It looks like they're well on the way to, perhaps by the end of the year, have this drug, RGN COVID-2, that could be helpful to produce antibodies. Would you be willing to talk about that today? I realize that we're not there yet, but this really sounds good. I know it's the article in the paper, so there's public awareness of it. So I think you know, to let people know that there are, besides the vaccines, there are therapeutics that are in the pipeline that could be beneficial as well, that are being tested and being worked on as we speak.
Yes, and I actually think you saw that. That's some initial phase 1 dose-ranging clinical trial data for Regeneron. These are called monoclonal antibodies. So you remember we authorized convalescent plasma, which is the plasma from a survivor patient. You have antibodies in your body. We can actually synthetically make those antibodies at ranges that could be 1,000 times more potent than what we can get out of an individual's plasma, and synthetically produce in mass quantities. Be thinking hundreds and hundreds of thousands of doses in very short order. And we have manufacturers in the country such as Eli Lilly, Regeneron, AstraZeneca, who have significant monoclonal antibody programs. We're seeing very promising early data that has been made public. We could be literally many weeks to a month or two away from having data to support emergency authorizations in these if the data proves that they're safe as well as effective.
Now, you mentioned a couple times today emergency authorization. We had, I think Dr. Fauci's made a comment on this before. Would you like to explain to us what emergency authorization actually is?
Yep. So, especially with vaccine, if I could. So, when we think about therapeutics, we might authorize a vaccine for a therapeutic for emergency use on a more limited data set as we continue to do trials. For a vaccine, because somebody is healthy and you're putting a vaccine to them, the FDA is requiring here 30,000 person clinical trials, so 15,000 placebo, 15,000 active, and demonstrating statistically significant results. That's the same for emergency or full-on licensure of the vaccine. The only real changes that happen with an emergency use are you would have ongoing safety data collection through a massive national pharmacovigilance program, and you would have ongoing, there are 3 validation lots needed for inspection of the manufacturing facility. But the actual data package, other than that longer-term safety data, is the same.
Well, Dr. Fauci made the comment that the emergency authorization is probably necessary whenever you see the data is so overwhelming that it would be unethical and immoral to withhold those vaccines or those drugs from people, because it could be saving lives while you're sitting there continuing to I-dot and T-cross.
Especially when you have safety. If you've got, like with convalescent plasma, you see well-demonstrated safety, and then you see clear trend of efficacy, it becomes an ethical question. Shouldn't you allow people to try that?
Okay. Very good. My time's up. I yield back. Thank you.
Thank you very much. I now yield myself 5 minutes for questioning. Mr. Secretary, I was reviewing comments made by the President at a Labor Day press conference where he gave this rosy prediction. He said one vaccine would be available very soon. You could have a very big surprise coming up. You will be very happy. The people will be happy. The world will be happy. The people of the world, everybody's going to be happy. And you know what I'm talking about before that very special date. Then we have, companies that are involved with the development, like Moderna, who said they would not be ready to seek emergency use authorization from FDA before November 25th at the earliest. Now, when you have the President of the United States making these rosy predictions, and you have contradictions by those who are responsible for the development, what do you think that does to your credibility and the credibility of FDA?
I think the President's trying to be hopeful, hold out hope for individuals, but I want to be very clear. This will be determined by data and independent processes. So, for instance, we don't even see data on these clinical trial programs until an independent data and safety monitoring board determines that the data in the clinical trial has achieved pre-specified statistical endpoints, and then it goes to the drug company.
Reclaiming my time, do you think, you just described the President's rosy predictions as being hopeful. There's a difference, you know, between being hopeful and misleading the people of this country. Do you think it's helpful to you when the President is out making these kinds of predictions?
The results will be driven by data. If a company produces data that's independent, that in the beginning of October determines a vaccine is safe and effective and submits it to FDA, and FDA's career scientists through an advisory board process determined it's safe and effective,
Reclaiming
then
my
that's what it is.
Reclaiming my time. Do you believe Moderna when it says it will not be ready to seek emergency use authorization from FDA before the latter part of November?
Well, what Moderna was saying with November 25th is that's based on the guidance that they received from
Whatever
the FDA.
it's based on. Do you believe them?
Well, you need to have the context. Their guidance was they need to have 60 days from the median patient completion in the clinical trial, and that would calculate out to November 24th.
Well, let me just try and frame this question, these questions a little bit differently. Do you believe that there is a contradiction between this hopefulness that you describe, that I describe as a prediction, and what Moderna is saying and others are saying about the readiness when a vaccine will be ready?
No, because...
Is there a contradiction?
No, because the CEOs of Moderna and Pfizer, I believe, both have said that we may see data in October. It's event-driven. It's data and science and event-driven. Nobody controls when we see data and whether we hit results.
So do you think that what you call hopefulness by the President is helpful and it builds confidence when the American people see that what he's predicting has no credibility and it is contradicted by those who are responsible for the development? Is that a problem?
But you're incorrect. What the President has been saying in terms of inspiring hope is within the range of possibilities of vaccine development, but it is out of our control.
Excuse me, reclaiming my time. He didn't say there is a possibility. This is more than what you're describing as hope. This is the President of the United States of America, the leader of the greatest nation in the world, and should be, in addition to being a role model, which of course we question, we should be able to rely on what he says. We should be able to have confidence that he's giving us good information, correct information. And as you know, as you sit here, no matter how you try to frame it, the President of the United States has not been the kind of role model that could create confidence in your agencies, what he has in himself, et cetera, et cetera. And I know that you said you will not reveal whether or not you have any conversations with the President about whether or not he's holding mass rallies where people are not safely distanced or wearing a mask or what have you. It would be very helpful to know that at least you have the strength and the ability to talk with the President of the United States and speak the truth about what he is doing or what he's not doing. I am absolutely surprised at the lack of strength of many of the people in this administration. But for you, with the responsibility that you have, I would expect that you would stand up to the president any time of day and say, Mr. President, please, you could be helpful if you support wearing masks everywhere you go. If it was a national plan that said everybody must wear a mask, everybody must be social distanced, and I'm not going to have a rally where people are jammed in and packed in. Why can't you say that to the president?
I'm not going to discuss my conversations with you with the president, but I would ask, you're a very influential member, if you could please inspire vaccine confidence. It's critical. It's critical to inspire vaccine confidence.
Reclaiming my time, and I know they say I won't let you answer the question, but you're going to come here and tell me to inspire
we all need
confidence, and you cannot tell me whether or not you'll tell the president to do that?
I have made very clear the independent processes for vaccine approval. If you would have let me speak, I actually could have walked you through the 4 independent steps on vaccine data and approval and consideration that would give people confidence any vaccine will be safe and effective.
Well, thank you.
I will take it, my family will take
Thank
it
you.
as soon as we're indicated and
Thank you.
prioritized.
Thank you very much. Reclaiming my time. I would ask you to think about it when you leave here. I ask you to think about it before you go to bed at night. When you get up and look yourself in the mirror the next day, I want you to think about whether or not you have the strength and the ability to say to the president what he should and should not be doing. And I think he should respect your advice and the advice of the experts. With that, I will yield to Ms. Melania the next 5 minutes. Thank you.
Mr. Secretary, the Select Subcommittee put out a memo this morning in which they identified this report at least 47 incidents in which political officials have intervened in the nation's pandemic response. Your department recently awarded 2 contracts to public relation firms to launch a coronavirus advertising campaign that is intended, according to the contract, quote, to defeat despair and inspire hope, exactly what Congresswoman Waters was speaking about. Now, Mr. Secretary, the reason so many people feel despair right now is because more than 207,000 people are dead. And this administration's response to this crisis has been worse than almost any other country. It would have been much more effective if President Trump had listened to the experts, if he had actually believed in science, or if he'd come up with a real plan before today to combat this crisis. Instead, this administration is spending more than $250 million in taxpayer funds to make videos with senior officials and celebrities in a massive ad blitz right before the election. In order to fund these videos, HHS diverted $265 million from CDC and FDA, even as both agencies are fighting this pandemic. This campaign was spearheaded by Assistant Secretary for Public Affairs, Michael Caputo. He said these contracts were, and I quote, demanded of me by the President of the United States personally, end quote. Mr. Secretary, is that true?
So I want to provide an update on this topic because I take seriously the value of public health communications efforts. First, I have ordered a strategic review of the...
Your response, reclaiming my time, Mr. Secretary. I want to keep an update on it, but I also want to know, is that true? Have you spoken to anyone about this ad campaign?
I was literally going to answer your question.
Tell me where it came from. Whose idea was it? Was it your idea?
I have ordered a strategic review of this public health education campaign that will be led by our top public health and communications experts to determine whether the campaign serves important public health purposes. I also have taken steps to ensure that any products coming out of this campaign will be reviewed and approved by career public health officials, including from the CDC. There are 3 key elements to this. What's already happened is the Surgeon General has done ads to encourage people to practice the 3 Ws. to donate convalescent plasma and to encourage minority group enrollment in vaccine clinical trials. The next wave will be to inspire vaccine clinical trials. The next wave will be to inspire flu vaccination as we enter in the flu season, and the third phase would be around COVID vaccination if we are fortunate enough to have an approved vaccine. But I will ensure that this is something our public health officials support.
Reclaiming my time. Part of this committee's oversight is procurement. So this contract, I'm incredibly interested in it, as one of them was awarded to a company called Atlas Research. And according to a press report this week, someone, we don't know who, recommended that Atlas use a subcontractor called DDT, which just happens to be run by Mr. Caputo's former business partner. And according to this report,